Cat scratches can hurt, they can burn, they can sting, and if your cat hits the wrong spot, they can certainly cause a lot of blood. Although a quick swipe can appear harmless in real time, a quick peek at your arm, hands, or face will often reveal how much damage can truly be done. The primary difference between a minor scratch and a painful infection often depends on the state of your cat's claws rather than the extent of the cut itself. Simply stated, the dirtier the claws, the worse the wound can become. Are scratches supposed to itch? While all feline scratches can cause your skin to itch, the core issue is the transfer of bacteria. Conditions such as cat scratch disease, tetanus, or cellulitis can occur. Although extremely rare, the contraction of rabies can't totally be ruled out, especially if the scratch came from the claws of a feral feline. In this video, we will explore how your skin reacts to a cat scratch, what determines the severity of the scratch, the most common infections associated with a claw scratch, and how you can treat these wounds, and also how you can prevent them from happening again. Whenever a cat scratch tears the skin, you are instantly put at risk for bleeding, stinging, swelling, and the wound itself becoming infected. While most cat scratches can be treated on site within moments, especially if you're already at home, some cat claw tears require professional medical attention. By comparison, a cat's claws are sharper than that of a dog. This is why all it takes is one quick swipe to do a substantial amount of damage. If the tear is quite deep, the risk of infection becomes all the more concerning. Trauma. That's the primary reason for swelling and itchiness. Pain typically accompanies these symptoms. While cats are known for their cleanliness, their feet can get very dirty. This certainly includes the claws. When dealing with this issue, it's important to note that it's what's on the claws, in respect to bacteria, that is often far more critical than the wound itself. A cut, while bloody and likely a bit gross in appearance, can typically be treated without issue. However, it's what's within the cut, due to bacteria, that can be the most troublesome issue of all. This is why cuts, even after treated thoroughly, must be monitored. If swelling and discoloration continue hours, and certainly days after the initial episode, you should seek professional medical care. Let's address the core reasons why cat scratches itch and swell. Number 1. Claw sharpness. Although very unpleasant to experience and certainly read about or hear, chunks of skin can be removed in short order if your cat's claws are long and sharp. Many clawing episodes often come on the heels of extreme mood swings and playtime gone sour. Cats have a tendency to become overstimulated. When this occurs, a calm petting session can change in an instant. Just one position movement or hand movement can cause your feline to lash out. This is why having your cat's claws trimmed is so very important, especially the front claws, as they are primarily responsible for inflicting injury. Although you can trim your cat's claws from the comforts of your own home, we highly recommend that an expert handles this matter. The last thing you want to do is accidentally injure your cat or get scratched yourself while in the process of attempting to relax your feline for a claw trimming. Number 2. Depth and location. The next core issue involved in itching and swelling is the depth and location of the scratch. Just like any other type of flesh wound, how deep it is and where it is typically plays a significant role in how the wound feels, how you feel, and how it appears to the naked eye. The depth and location aspect can be the difference between a minor and inconsequential scratch or a serious wound that requires professional care. Injuries to the face, neck, lips, or eye region are of major concern. Cat's claws act in a hooking motion when they swipe. This hooking action can result in extreme flesh damage and removal, especially to sensitive skin regions. Number 3. Your personal health. How is your general health? So much of how your body reacts to a cat scratch depends on your own personal health. How old are you? Do you have any existing health ailments that negatively impact your immune system? As a word of advice, if your body does not recover easily after any type of disease or immune-hindering ailment, you should certainly give it great thought before deciding to own a cat, at least full-time. Unless other family members will be responsible for the feline, it can be quite a task to assume responsibility if you are in a poor standing of health. Number 4, the health of the cat. As we've mentioned a few times already, the health of the cat in question does play a huge role in how a scratch will impact you. Cats that are well kept within the home and have a clean litter area are far less likely to carry bacteria and disease. This is typically the core difference between a minor scratch and quick healing compared to that of a scratch or puncture resulting in a serious medical issue. If you've been scratched by a feral cat that is essentially living off the land, you are potentially at extreme risk for a variety of medical problems. This is unfortunate, but true. In this section, we will briefly detail a few of the ailments that you should always be mindful of if you're ever scratched by a cat. This is especially true if the wound worsens in the passing hours and days. In no particular order, several diseases and infections can include cat scratch disease. This occurs when bacteria is transferred during a scratch, bite, or the licking of an open wound by a cat. Symptoms and complications typically arise some 72 hours to 2 weeks after the episode. Issues such as swelling, redness, and pustule lesions can occur. The area in question may also feel quite painful and warm to the touch. Headache, fever, fatigue, and a lack of appetite can also take place. The next concern is tetanus. Quite rare due to a preventative vaccination, tetanus is a bacterial infection that can potentially arise from an open wound caused by a feline. Tetanus can be fatal in some cases. Muscle spasms and lockjaw are often the hallmark symptoms of this condition. This is why it is paramount that you receive a tetanus shot once every decade. This is a wise precaution if you have a feline in the home. Defined as a bacterial infection of the skin and the tissues directly underneath, cellulitis can also occur if your skin has been broken due to a cat scratch. Extreme redness, pain, swelling, and warmth around the injured area are the common symptoms. Our final issue is rabies. Although it is incredibly rare that you would contract rabies from a cat scratch, it is certainly worth discussion. Feral cats can do a lot of damage. The unknown factor is at play here. Foxes, skunks, raccoons, and bats can easily contact a feral cat or even a neighborhood cat, depending on your location. If a cat were to scratch you after it had become rabid, then your health would be at great risk. It's important to always remain vigilant. Never attempt to place your hands near the face or feet of a stray cat and never pick it up. Act responsibly as a course of least regret. If you are concerned that you could be in danger following a scratch, seek professional medical care immediately. The sooner, the better. Although prevention and protective measures can be quite simple and logical, it's easy to forget, especially when you're lost in the moment while playing with your cat. Some ways to avoid scratches can include avoiding rough play with your feline, keeping and protecting open wounds from your cat, never allow a pet to lick existing visible cuts or abrasions. As we've mentioned earlier, never pet or engage with a feral cat. Never pick it up, remain at a respectable distance. Keep your own cats in positive health. The healthier and cleaner they are, the healthier and cleaner their claws will be. And finally, keep your cats indoors. This eliminates a lot of guesswork as to where your cats have been all day. If your felines are living with you in between your four walls, then much of the mystery is eliminated. This is good for everyone involved, should scratching ever take place in the future. Unless you require professional medical attention, the treatment of a scratch is rather basic and straightforward. Clean the area with antibacterial soap and water. Apply gauze if the wound is bleeding. Keep pressure on the area until the bleeding has stopped. Use a topical cream to medicate and close the wound if it's minor in nature, and apply a small bandage if needed. By and large, most scratches caused by a cat will be similar to that of a fingernail scratch, a single thin line, perhaps multiple lines, with minimal blood drawn. If that's the case for you, these basic treatment tips can come in handy. As a word of caution, any scratches to the eye require urgent care, especially if your vision has been compromised. Clean the eye with water as a measure to flush out bacteria and debris while seeking medical evaluation. It is wise to do this, even if everything appears to be fine. You never want to mess around with your vision, so medical care of a professional variety is necessary. On that note, that'll wrap things up for this video. We hope you found it helpful and informative. Whether you're joining us from SeniorCatWellness.com or happen to find our video on the YouTube platform, we hope you'll subscribe to our channel. We produce new content on a regular basis, so click that subscribe button and join our family. Have you ever been scratched by a cat and needed professional care? Did you wind up with an infection or worse? If so, please drop me a line in the comments section below. For educational purposes as a means to help others, I'd love to read your story. It could potentially be of great benefit in terms of proactive measures and treatments, especially for new cat owners. Until next time, we thank you so much for watching. We wish you all the best, and we hope you have a wonderful day.